Yo, what is up, my Nakama? So my name is Daniel and I'm a current third year medical student on a 1-year leave of absence. And in this video, I'm going to share how I studied 2 hours a day during my clinical rotations. And yes, it is possible to only study that much in medical school. Let's get started. So my last rotation before I started my leave of absence was internal medicine. And the one thing that was killing me during internal medicine was basically I was balancing a full-time job with studying for my shelf exam. So sometimes I would have clinic days of 12 hours and then I would have to come home and study for an additional 5 hours, or at least I felt like I had to study for an additional 5 hours in order to do well on my shelf exam. And this type of studying was really unsustainable because I was getting less sleep, I didn't have time for exercise or personal activities, and I was approaching burnout. And during the preclinical years, like when you're just in lecture and studying for step 1, it's a lot easier to manage this because you are not in clinic. You don't have any hospital responsibilities. Your only responsibility is to study and learn the material and pass your in-house exams. And so it was a lot easier during this time to study for 8 hours because that was the only 8 hours that you had to do during the day. So with all this in mind, I decided to try something radical during my internal medicine rotation. A completely new study strategy that is going to blow your mind. And it's not some ultimate technique and it's not some new crazy technique. But what it actually is to stop studying. Now hold up, let me explain. And I think that my situation can apply to a lot of people, not just in medicine, but in university studying for exams. So when I was in neuro and psych, the 2 rotations that I had before internal medicine, I noticed that I was repeating a lot of things, meaning that I would see a patient in the clinic with a certain disease or a neurological problem, and then I would study that same problem outside of clinic. And I think this is what added a lot of time to my overall day, because I didn't learn my patient right then and there. I would spend a lot of time reading supplemental material outside of clinic, when I could have just intently listened to the attending or the resident explaining about the patient. And I felt like I just didn't truly appreciate the learning opportunities that each patient had, or that I could learn from each patient. And also, I was kind of timid and nervous during my first couple of rotations, so there was a lot of questions that I would have during a presentation or when the attending was talking about a topic that I just wouldn't ask because I was just kind of scared to ask and make a fool out of myself. So there was a lot of missed questions and opportunities that I had to learn during my first couple rotations. So during internal medicine, I took my patient care to the next level. Basically, every opportunity I had to learn my patient's disease manifestation, I would learn inside and out, and I would learn their patient care and I would learn their management. And I would do this all while I was in clinic, while I was treating that specific patient. This wasn't like outside studying I was doing, it was while I was writing the patient note or while I was coming up with their treatment plan. And I would discuss this with the residents and see their thoughts and see if they agreed with me or not before I even presented this to the attending. And then from the attending, I absorbed every single lesson that the attending would give. And I would listen really intently to all the lessons that they had, to all the thoughts that they would share. And I wasn't even afraid of being wrong about a diagnosis. I just put myself out there 100% confidently. And even if I made a fool out of myself, I just adopted the mindset that I'm in medical school to learn and to correct from my mistakes. And it's a good mindset to have because my responsibilities are pretty low in terms of the chain of command. I'm kind of the bottom of the totem pole, so it's okay if I mess up. It's okay if I say something wrong because I can't even place orders. I'm not the one doing any procedures. So this is the time for me to be wrong. And I'm wrong a lot. I say a lot of wrong things. I get the diagnosis wrong. I say the wrong medication. But each time I say the wrong medication or my treatment plan is incorrect, I treat that as a learning opportunity. And I learn from my attending or my residents who are correcting me. And so with all this in mind, I was basically learning so much during my clinic days, or the hours that I spent in the hospital, that I didn't really have to study at home when I came back at 5 or 6 p.m. And my routine beforehand was, I would come back at 6 p.m. and I would spend maybe until midnight, on Up to Date or on other third-party websites, like Online MedEd, just learning the same material again. And I am all for spaced repetition, and I did do Anki throughout the day when I had time to, but I was taking the repetition too far. I felt like I wasn't learning when I should have been learning, and I was kind of letting the information just float past my mind, not really absorbing it when people would actually explain things to me. And then I would take the burden of learning it when I came back home because I felt like that was the proper way to study. And the way I kind of shifted this mindset was just learning right when you had the opportunity, learning from your patients, learning from when the attending would share their thoughts with you. And honestly, if you pay attention and are focused enough during those encounters, then there isn't too much of a need to study outside of your clinic hours. Now, I did of course do Anki and I did UWorld, and those were pretty much the only two resources I stuck to as well. I feel like if you overburden yourself with too many resources, and there's a ton out there for medical school or for whatever subjects you're studying, then you're gonna spend more time studying because you feel like you have to get through all those resources. So limiting resources was definitely a huge impact into the time that I spent studying. And for me, by only having two, that means all I had to do was a few UWorld questions each day and my Anki. Now, just to discuss my UWorld questions actually for this exam. So before, like in neuro and psych, I would do 100% of the UWorld questions for that shelf exam. And there were about 300 or 400 questions for neuro and psych, and I did okay during those rotations. But what I decided to do for internal medicine, and those of you who have done internal medicine, you know that there's probably like 1,500 questions, and it's really hard to get through them all before your shelf exam. So I only did like 5 or 10 questions a day, and I ended up only completing 1/3 of the entire question bank in UWorld. And so here comes the shelf exam day, and I'm a little nervous, but honestly, I was proud of my clinical accomplishments that I didn't really care how I would do on shelf. And I remember just going through that shelf exam, and it was probably the only shelf exam out of the 3 that I took so far that I came out of like really confident and actually happy about my results before I even got the results back. And the reason was because when I was reading a lot of the passages, I was connecting it back to patient encounters. And that was something that I never did before, because before I would just try and search my memory through Anki cards or through UWorld questions that I did that looked similar. But this was the first time where when I would read a patient passage, a description of a patient, it would sound almost like someone I took care of, like someone that I saw with a heart attack or someone that I saw with a COPD exacerbation. And rather than my mind going back to Anki flashcards, which it used to, I was actually going back to the discussions I had while I was treating this patient. I was going back to their diagnostic care. I was going back to their patient management and the medications that we gave them and the diagnostic tools that we used and how we interpreted them. And I just felt pretty confident the whole time while I was taking the test. And it was such a weird but like wonderful feeling to have taking a shelf exam, because the shelf exams are usually pretty dreadful and I feel awful while taking them. But this was the first time where I, submitted my exam and I felt confident, and it ended up being my best shelf score yet. And it's hilarious because ironically it was the shelf that I studied the least for in terms of total hours that I put in. So basically, I guess kind of what I want to say to you all who feel like you are spending way too much time studying for whatever subject it is to kind of take a step back and reevaluate how much time you're putting into studying and your study methods. Now, I would still stick to the same resources that work for you. I wouldn't drastically change the resources you use, but maybe think about limiting the amount of resources, only sticking to 1 or 2 very high yield resources that actually work for you. And the second thing I think is that something you can apply no matter what subject you're in is really pay attention during your lectures and go to TA office hours and really be engaged during these interactions. Because if you're not engaged in this, you're just gonna spend that much more time studying at home when you could have just learned it the first time in lecture. And obviously, you might have to repeat some things over and over again until you master the concept fully. Like if you're taking some sort of organic chemistry or Calc 3, you have to do practice problems on the side. But if you're really focused and engaged during lecture, then that kind of minimizes the amount of supplemental time you need to actually learn that subject again. Now, one thing I have to say is that it's not like I was going into my clinical years without a single amount of knowledge. I had a huge and strong foundation from my preclinical years and from studying from step 1. So I had that groundwork laid out, and basically all I had to do during my rotations was just learn new information, learn about patient care, and kind of apply that to my already existing knowledge, which I spent so hard working towards. And I do think there's no way of getting around building that framework, that base of studying. And whenever you're starting a new subject, yes, you're going to be putting in 6 to 8 to 10 hours of studying to learn that material. There's always sort of a base groundwork that you have to lay down. But once you have that groundwork, learning material on top of that is like supplemental or more advanced, should actually not require as much time as learning that groundwork, because seeing a new subject for the first time is challenging. Like, I had never taken an anatomy course before my anatomy lab. So I spent a lot of time in lab, dissecting the cadaver, going over the anatomical parts. And by laying this groundwork, when it came time to use that anatomy during my next units in medical school, it was a lot easier because I already had that baseline foundation and I just had to apply that to the new subject. But yeah, this is basically how I studied 2 hours a day during my internal medicine rotation. It's something that when I get back into my medical school studies and my clinical rotations, I'm definitely going to apply to, because by only studying 2 hours a day, it allowed me to basically live a balanced life, to be able to work out, to be able to create videos like this, because, I could spend my entire time, like 16 hours a day, in clinic and studying, but that just is going to lead to a process of burnout, and that's something that I don't want for myself, and that I don't want to bring into the hospital, that sort of negative energy to my patients. And I think this is a pretty good balance that I found. If you agree with me or have any other cool ideas or suggestions about how you minimize the amount of studying you do in medical school or in university, feel free to leave a comment below. I hope you all enjoyed this video and found this information useful. Stay strong and healthy, my Nakama, and as always, Dattebayo.